Hello, I am Rob Wiley, Chief Medical Officer at Hendrick Health. And there are lots of questions I get in the role I play, but one of the questions I continually get is why do underlying conditions make COVID more severe? Well, at any age, a patient or an individual with an underlying condition is at increased risk of more severe illness. More severe illness, what does that mean? Well, severe illness means the risk of being hospitalized, the risk of being in our ICU, the risk of being on a breathing machine like a ventilator, or even death. So you would ask, what are some underlying conditions that would affect and make COVID worse? Well, it's pretty simple, and you want to put it in simple terms. COVID affects pretty much every organ system within our body. So any organ system that you can have problems with an underlying condition will make COVID worse. So for example, if you talk about the cardiovascular system, whether you have coronary heart disease or cardiomyopathy, congestive heart failure, if you have hypertension, you're at risk for more severe illness from COVID. If you have pulmonary disease, such as chronic lung disease or COPD or asthma, pulmonary fibrosis or cystic fibrosis, you're at risk for more severe illness. If you have issues with your immune system, whether it's from an autoimmune disorder like rheumatoid arthritis or lupus, or if you're taking medications that affect your immune system like chemotherapy, you're at risk for more severe illness. There are other organs that you would think of, such as your GI tract, your endocrine system. So for example, if you have diabetes, you're at increased risk for more severe illness. There are some other things that will put you at risk, some other underlying conditions, such as obesity and smoking. And obviously, your age can be an underlying condition and create issues with more severe illness. As a pediatrician, I get asked, how does underlying conditions affect children? Well, children, they tend to have less severe disease, tend not to be infected with COVID as much. But if they have an underlying condition, they're also at risk for more severe illnesses. So for children who have congenital heart disease or asthma or some autoimmune disorder, they are at risk for more severe illness. And another obvious condition, underlying condition that you can see is obviously a patient who's being treated for cancer. Cancer in of itself is a risk and increases the severity of illness, not only the treatment, but the disease itself. How do these underlying conditions increase the severity of COVID? Well, you can imagine COVID affects pretty much every organ system within your body. So if you have problems with your heart, your lung, your kidneys, if you have issues with any nervous system, that's already going to put you at a compromised position. And you put COVID on top of that, that increases the severity of the illness. So how do we as an individual and community decrease the spread of COVID? The first one is to wear your mask anytime you leave home. Number 2, you should be washing your hands frequently before and after any activity. You should be cleaning surfaces. You should be using a disinfectant that has 70% alcohol. 3, social distancing, because you've got to decide, where will I go? It's important. I am concerned about our community. Our goal is to continue to thrive as a community and to be able to stay open.